Hi, welcome back to Mental Health Monday. I'm John Cothran, founder of Work It Out Counseling. Our videos are not intended to replace a therapeutic relationship with a counselor. Now, this is the second episode covering post-traumatic stress. And today we are talking about some therapies that have proven effective in resolving post-traumatic stress. Not every therapy is going to be the most effective for each person. The traumatic therapies I use the most frequent are accelerated resolution therapy, or ART, and reconsolidation of traumatic memories, or RTM. The reason I have chosen these two particular therapies to specialize in is the rate of effectiveness and time involved in resolving the trauma from the events that are distressing for the client. There are other therapies such as eye movement, desensitization reprocessing, or EMDR, and cognitive processing therapy, or CPT, that therapists are trained in. You can visit the websites for each form of therapy to determine which may be the best one for you and to find a trained therapist in your area. ART incorporates a combination of techniques used in many other traditional psychotherapies. ART works directly to reprogram the way in which distressing memories and images are stored in the brain so that they no longer trigger strong physical and emotional reactions. ART accomplishes this through the use of rapid eye movements, similar to eye movements that occur during dreaming. Techniques similar to these are used in other types of therapies. ART's very specific and directive approach can achieve rapid recovery from symptoms and reactions that may have been present for many years. ART is evidence-based treatment recognized by the Veterans Administration and can resolve trauma in 1 to 5 sessions. RTM is a visualized treatment but uses a protocol which allows the patient 3 levels of dissociation from the event. When the patient is able to discuss the event with very little to no discomfort, it is presumed to have worked. During the procedure, the patient is not required to fully re-experience the event, but is kept safe by the therapist. RTM has also been highly successful in resolving traumatic events in 1 to 5 sessions. We may also recall details we had previously forgotten and gain more insight into the event. EMDR therapy is an 8-phase treatment. Eye movements or other bilateral stimulations, such as tapping, are used during one part of the session. In successful EMDR therapy, the meaning of painful events is transformed on an emotional level. Unlike talk therapy, the insights clients gain in EMDR therapy result not so much from clinician interpretation, but from the client's own accelerated intellectual and emotional processes. The net effect is that clients conclude EMDR therapy feeling empowered by the very experience that once debased them. CPT treatment begins with psychoeducation regarding post-traumatic stress disorder, thoughts, and emotions. The patient becomes more aware of the relationship between thoughts and emotions and begins to identify automatic thoughts that may be maintaining the PTSD symptoms. The patient writes an impact statement that details current understanding of why the traumatic event occurred and the impact it has had on beliefs about self, others, and the world. Next, the patient writes a detailed account of the worst traumatic experience, which the patient reads in the next session to try and break the pattern of avoiding thoughts and feelings associated with the trauma. Finally, once the patient has developed skills to identify and address unhelpful thinking, he or she uses those skills to develop evaluating and modifying beliefs related to traumatic events. At this point, the therapist is helping the patient develop the ability to use these adaptive strategies outside of treatment to improve overall functioning and quality of life. Therapists may particularly focus on safety, trust, power, control, esteem, and intimacy, as these are all areas that can be affected by traumatic experiences. CPT can be delivered both individually and in structured group sessions. Regardless of modality, patients will have out-of-session practice assignments. CPT was originally developed with the written trauma account as one component of treatment, but sometimes it is delivered without this and more emphasis is placed on cognitive techniques. Now, it is up to the patient to determine whether they want to accelerate the resolution or are okay with it taking longer. Keep in mind there is a range of time for resolution as each person is different. Tune in next week as I discuss some more behaviors to pay attention to that may indicate we, a loved one, or friend may be suffering from post-traumatic stress. If you have feelings of harming yourself, please reach out to the National Suicide Prevention Hotline at the number on the screen a licensed counselor in your area, a family member, friend, your insurance company, or clergy. We are not in this alone. There is help and resolution from the very event causing us distress. If you like what you have heard, visit us online at www.wiomhc.com or find us on Facebook at Work It Out Counseling and on Instagram at WIOMHC. You can also subscribe to our YouTube channel and catch up on previous episodes. The link is in the video description. Thanks for watching, and we'll see you soon.